The federal government is stepping up its response to monkeypox. According to the CDC, more than 13,000 cases have now been confirmed in the U.S. as of August 17th. 98% of them are men. CDC Director Dr. Rochelle Wazinski spoke at a White House monkeypox briefing earlier about their strategy.
HHS is announcing a pilot program for additional vaccine allocations to state and local health departments whose jurisdictions are hosting events that draw a majority of people from the MSM community. Jurisdictions hosting these events can request to receive additional vaccine allocations based on the size and nature of the event and the ability to reach attendees who are at the highest risk of monkeypox.
For more, I want to bring in Dr. Dennis Nash. He's a distinguished professor of epidemiology at the City University of New York. Thank you so much for being with us tonight, Dr. Nash. I do wonder, 1.8 million doses of the monkeypox vaccine, what's significant about that number to you?
Well, there's a really short supply of vaccine right now, given the demand and the need. And, like anything in short supply, the challenge is always getting the vaccine to the right people at the right time and importantly, in an equitable fashion. It's great that more vaccines are coming. We need many, many more. It's great that there are steps being taken to extend the supply of the vaccines that we do have. But part of this really smacks of the early rollout of the COVID vaccine. It didn't go well at that time either in this regard, and we're seeing some similar problems here, which is really frustrating to watch.
Yeah, we already heard from the CDC earlier this week that they felt they mishandled some of this and are looking at the future as to how to do a little bit better. I do want to talk about, I think it's very confusing for people about who's most at risk of being infected. We said 98% of cases seem to be men, but people are not calling this a sexually transmitted disease, even though a majority of cases do appear to be men who have sex with other men. Can you tell us a little bit? There seems to be some fear for people. If I'm on a crowded subway, if I'm on an airplane, can I get this? If I'm on a concert, can you break down who's, most at risk here?
Well, it's true. Right now, men who have sex with men are most at risk. They constitute the overwhelming majority of cases. But sexual contact between men is just one way that monkeypox can be spread. It's not the only way. And so, we're already seeing examples of it spreading in other individuals. And so I do think we need to be prepared. But casual contact on public transportation and things like that is not a way to get monkeypox. It does require close contact, skin-to-skin contact. And so it is very concerning, the monkeypox outbreak, and we need to do as much as we can to contain it while we deal with these vaccine supply issues and getting adequate treatment supplies and things like that. So it is something to be concerned about.
And making sure we're getting the vaccine to the right people at this point in time, too, to try to contain it. Is that what you're saying? Okay.
Yes,
so
and I think that,
No,
sorry,
go ahead.
I was just going to say, I think that we're seeing examples of how even within the men who have sex with men community, the vaccine is not being distributed equitably. If the majority of cases are occurring among men of color and the majority of vaccines are going to white men, that's obviously an equity issue that needs to be addressed in the process for delivering these vaccines.
It's a really important point. I do want to move on. There are some other really big headlines happening. In New York City in particular, it recorded its highest number of West Nile virus infected mosquitoes. West Nile virus is extremely dangerous, potentially. I had a friend growing up who was in the hospital for several weeks after their brain swelled from this. Should people be concerned that this is a new finding in New York?
Well, it is concerning. It's not a new finding. West Nile has been here in New York City and in the U.S. since 1999 when it emerged in the Western Hemisphere. So it is an example of what we're seeing with emerging and re-emerging infections like COVID, like polio, and like monkeypox. Because it's been here since 1999 in New York City and around the country, we are very good at preventing it. And when it does begin to spill over from mosquitoes into humans, at preventing mosquito-borne transmission. So yes, 2 cases are always concerning, and it suggests that there's transmission happening around the city. There are efforts to reduce the risk that mosquitoes pose to humans, both through spraying of pesticides to reduce the adult mosquito population, and protective measures that people can take when they go out at dawn or dusk when mosquitoes are biting, such as mosquito repellent.
Yeah, it's the simplest way. You brought up polio. It's been detected in New York City's wastewater. How severe, in your mind, is the risk of a polio outbreak at this point?
I think it's very severe. Well, it's already happening, right? And it is most concerning in communities where there are lower vaccination rates. Like many infectious diseases, a certain proportion of the population needs to be vaccinated in order to prevent these kinds of outbreaks. With polio, it needs to be above 85%. And we know that there are many communities around New York and around the country where the vaccination levels are much lower than that. And when we see community spread like we're seeing now, identified through wastewater surveillance, there's the potential for more cases of polio and unfortunately more cases of paralytic polio. And we really hope that doesn't happen, but there's definitely potential for that to happen. So it's so important for people who are not vaccinated to go out and get the polio vaccines.
Yeah, it can be so dangerous. Dr. Dennis Nash, thank you so much for joining us. We appreciate it.
Thanks for having me.